Good afternoon, and welcome everyone to the presentation ceremony for the 2020 Con Hogan Award. I'm Steve Dale, a member of the Con Hogan Award Committee and a former public official here in Vermont. Before we move into the content of our ceremony, let me explain a little about this format. Although the presenters today are part of a Zoom, most of us are watching this on YouTube. We thank our partners at CCTV who are handling the technology for us today, thank goodness. This presentation ceremony can be accessed later today through the Vermont Community Foundation website. Normally, we present this award in person at a big event. We miss the opportunity to be with you all in person, but hope that this medium will capture the essence of this important award. Thanks for being here. The late Con Hogan was an important figure in Vermont. From his work in the public, nonprofit, and private for-profit sectors, he exemplified the kind of thinking and leadership that Vermont needs as we address the challenges of this moment. Con's down-to-earth management approach was always backed by both sophisticated, tested theory and a nuts and bolts practicality. The Con Hogan Award for Creative Entrepreneurial Community Leadership was created in 2015 as a way of recognizing the contributions made by Con to the state of Vermont by encouraging and rewarding leaders who, first of all, share his vision of a Vermont that places the highest value on the public good, and secondly, who demonstrate his leadership qualities in achieving results. This year, we are very excited to present this award to the Vermont Department of Health. I want to call attention to two groups of people as we get started. First is the Con Hogan Award Committee, which oversees this program, and they will now join us on the screen. They're Will Belanger from the Vermont Community Loan Fund, Paul Sillo, Public Assets Institute, Scott Johnson, consultant for Dulce, Vermont, Ellen Kaler from the Vermont Sustainable Jobs Fund, Jane Kimball from the Vermont Community Foundation, Diana Wally from Wyndham Southeast Supervisory Union, and myself. And I want to thank all my colleagues for making this award possible. Second, we want to recognize the award recipients of the Con Hogan Award from the previous 5 years. And we would like to show a slide of their pictures. They are Ellen Kaler of the Vermont Sustainable Jobs Fund, Michael Monty from the Champlain Housing Trust. Here we are. Holly Morehouse of Vermont After School, James Baker, who at the time was a criminal justice consultant and is now Commissioner of Corrections here in Vermont, and Jan Demers of the Champlain Valley Office of Economic Opportunity. And we want to remind you all of their awards, congratulate them, and thank them for their many years of great work here in Vermont. We would have a large round of applause if we were all together. Thank you. A few things need to be said about this year's selection process. In case you all haven't noticed, this year has been like none other. The selection committee connected in mid-March to begin the process of identifying possible recipients of the 2020 award. Needless to say, the environment was not conducive to seeking nominations. Most people were not at work or were focused on other things at that time. By June, it was clear that Vermont had quickly developed an approach to managing COVID-19 that was more effective than any other jurisdiction in the country. We were quickly drawn to the idea of recognizing those people who have helped engineer Vermont's response. Given the magnitude of this pandemic and the response that has been necessary, We decided not to honor one individual, as has been our normal practice, but to honor the Vermont Department of Health, the entire Vermont Department of Health, both its managers who have guided the process and have assisted the governor in developing policy guidance, as well as the line staff who have shuffled jobs and responsibilities and have responded to the call in ways that have benefited us all. I do need to note that given that VDH is a public entity, we will not be providing a financial grant this year. We will resume the traditional format in 2021. Before delving into this year's award and the Vermont Department of Health, we wanted to remind the audience of Con Hogan's contributions to Vermont. In 1973, my wife and I moved to Vermont, where I had been hired as the juvenile probation officer for Windsor County. We knew no one in Vermont, and it's quite something to think that there was only one juvenile probation officer in a whole county back in those days. In that role, I soon met Con Hogan, who was the Deputy Commissioner of Corrections. I worked with him for the first 6 years I was in Vermont, and then again after he returned to state government as the Human Services Secretary in 1991. Con was a force of nature. His overriding commitment was to do the best thing for the people of Vermont and to engage them in the process. We who worked in state government were expected to be key players in supporting the overall effort, but we were only one partner. His approach was to provide to everyone data about the indicators of community well-being, and then to engage a wide array of organizations and individuals in changing the trajectory of those indicators. I remember one community meeting which focused on the high teen pregnancy rate in a particular county. By calling attention to the issue, inviting people from that county to come together, and mobilizing state and local human and financial resources, the trend line in that county changed dramatically over time. Those of us who worked in state government were not expected to go out and attempt to fix everything, but rather were expected to come alongside communities to support them in the improvement process. Listening to Commissioner Levine at a recent press conference, I could not help but feel the same burning sense of pride in this Vermont approach. We share a common challenge. We share a common desired result. We need to follow the science and the data, and together we can make a difference. The person who knew Con best was his wife, Janette. It is my privilege now to introduce her to share some thoughts about Con to help remind us of the man and his contributions to Vermont.
Hi, sorry that this has to be on a video, but health issues have taken over. But once again, I am delighted to be part of this award ceremony. First off, I want to congratulate the committee for preparing this virtual ceremony, and especially congratulate them for coming up with this wonderful idea of giving the award this year to the entire Vermont Department of Health. When it was first announced, I had a very brief email from a friend of mine, somebody a lot of you know, Bill Schubart, and it was a 2-sentence email. It said, "This is a great idea. Con would have loved it." As many of you know, neither Con nor I have ever been on the selection award committee, but they have always kept me apprised as to what their comings and goings are, what their ideas are, and how things are going. This year, when I was told by one of the committee members about this award, they said when they had first approached Dr. Levine about the idea, his reaction immediately was, "Oh my goodness, please do not ask me to name one person in the health department for this award because they have all done so much work for it." That is the big reason why Con would have loved it. He liked nothing better that when a project was being done and a lot of people were working on it, he loved to spread around the thank yous and especially the credit for all the work that all those people had been doing. Also, for those of you who knew Con really well, he was a data man. And I think that in my introduction, Steve Dale already alluded to that, or in his early words about Con. If you went to Con and talked to him about a program that you were working on, or that was going very well, or that it wasn't going very well, his first statement to you would have been, "Show me the data." Well, goodness knows the entire Department of Health has collected and analyzed and publicized the data that they have gathered on this amazingly pandemic more than anyone would have thought possible. So congratulations to every single person in the Vermont Department of Health on an amazing and difficult job well done. And thanks to the Hogan Selection Committee for putting this all together. Thanks and goodbye.
Thank you, Janette. That was extraordinary. Let us turn our focus fully to this year's award recipient, the Vermont Department of Health. Their efforts have been nothing short of heroic. I've heard a lot about heroes during this time. It is true. Their steady, methodical presence has made all the difference in keeping us focused, in preventing an endless spiral of the virus, and in providing the data and stories that help us all make good decisions that are in the public interest. How blessed we are to have a professional unifying force guiding all of us. There's one person who would like to share some perspectives on this much-deserved award. Governor Scott has been one of the true national leaders in responding to and managing the pandemic. He has followed the science. He's been honest and transparent. He has remained calm and has been amazingly practical. He is in a better position than anyone else in Vermont to fully appreciate the efforts of the health department. It is my honor to introduce Governor Phil Scott.
Thank you so much. I'm pleased to add my congratulations to Dr. Levine and the entire Department of Health. This award is in recognition of the amazing work they've done during this pandemic. I want to thank Dr. Levine and everyone at VDH for their commitment to the people of Vermont. So many have gone above and beyond, working extremely long hours, and all for the public good. Overall, Vermont has fared better than most states, even with the recent uptick. I believe it's mainly due to our DNA as Vermonters, but it's also because of the talented and dedicated public servants working within state government. As we've worked our way through the response, the health department has been front and center in providing science-based guidance and data. They've been invaluable to me in making a number of very challenging decisions. Additionally, VDH has continued to provide steady and consistent information that allows Vermonters to make good, healthy choices. Another effort to appreciate is the constant and methodical changes the department has made to combat this virus. Staff have taken on new assignments. They've created new partnerships, expanded testing, and built up contact tracing. And that's all while working longer and unusual hours. And for many, that's frontline work. That adaptability is much of what this award is about. Going after a virus is not a function of wishful thinking. It's hard, methodical work. I always try and find a silver lining in any scenario. And while this year has been difficult, the silver lining is that Vermonters now know and understand the importance of the Vermont Department of Health and can now fully appreciate how important public health is. To all the staff at VDH, I congratulate you on receiving this award and thank you personally for all you do to keep us safe and healthy.
Thanks so much, Governor Scott. Upon hearing of this award, Senator Sanders contacted us to offer his congratulations to the Vermont Department of Health. I would like to invite Beth Stern from his office to share Senator Sanders' thoughts. Beth, thanks for joining us.
Great, thank you for having me. So thank you so much for inviting me to speak for Senator Bernie Sanders, honoring the Vermont Department of Health with the Con Hogan Award. I have a letter from Senator Sanders that I will read in a minute, but before I do that, I'd like to take a moment to let you know my own connection with Con. I live on the Plainfield side of Marshfield. Con lived just a few hills away. When my son was small and going to daycare, I would pass by Con's house and horse farm almost every day after I dropped my son off at daycare and headed to work in Barrie. We also attended at least one 4-H fundraiser at his horse farm and always look forward to listening to his band, Cold Country Bluegrass, when they played in Plainfield. Professionally, I knew him as Secretary of the Agency of Human Services. At that time, I was working for Central Vermont Council on Aging. I was always amazed at his extensive knowledge of all aspects of human services and his focus on data-driven excellence. Despite his high-level position, he was always accessible and helpful. Now, I will read this letter from Senator Sanders, who sends his congratulations and his regrets that he can't be here today. Dear Dr. Levine, I would like to send my sincere congratulations to you and the entire Vermont Department of Health for winning the 2020 Con Hogan Award for Creative, Entrepreneurial, and Community Leadership. The Department of Health's early recognition of the severity of the COVID-19 pandemic and data-driven leadership in containment, testing, and contact tracing is a testament to the hard work and dedication of you and your staff. I am especially grateful for the innumerable sacrifices you have made to protect all Vermonters, including essential workers, low-income people, and our most vulnerable communities. At the federal level, I am committed to working with the new administration to pass a meaningful COVID-19 relief bill and follow the science to eliminate this deadly virus. I'm pleased to join with your friends, family, and colleagues in congratulating you on this well-deserved recognition. Sincerely, Bernard Sanders, United States Senator. Thank you.
Thanks so much, Beth. And please thank the senator for us. We really appreciate it.
I will, thank you.
Now to share with you the specific language of the nomination and to present the award, I am pleased to introduce Paul Cielo, President of the Public Assets Institute and one of the founding members of this award. So Paul.
Thank you, Steve. We're delighted to make this award today to recognize the work and commitment of the staff and leaders of the Vermont Department of Health. There are more than 500 staff members work year in and year out to keep Vermonters healthy and safe. And they're everywhere, though often not in the spotlight. Using the health and all policies approach, for example, the health department collaborates with agencies across state government to bring a health lens to policymaking, transportation, housing, agriculture, education, everywhere, using every opportunity to improve Vermonters' health. But policymaking is by no means all that the department employees are doing to protect and promote the health of the state's residents and visitors. Emergency preparedness is another crucial role, and this year we're seeing the results of their preparation. The health department put their incident command structure into gear in February this year, before there was a single reported case of COVID in the state. Crisis situations like this demand immediate needs assessment and quick action. Vermont saw its first COVID case on March 7th, and the governor's stay-at-home order was in place 17 days later. The department is constantly collecting, synthesizing, and analyzing data to support their science-based decisions. And they need to be adaptable as the data indicate changes that require changes in their response, as we saw in June with the COVID outbreak in Burlington and Winooski. The department's early recognition of the dangers of the virus, their calm, quick, and expert response to reported outbreaks, and their consistently honest, straightforward, and compelling communication has inspired Vermonters to keep each other safe during this pandemic. As a result, we've maintained one of the lowest positivity rates in the country. I want to point out that this year has been exceptionally demanding for the health department staff. While their work related to the pandemic is in the spotlight, staff continue their regular jobs on the myriad issues handled by the department before the pandemic. So to all health department staff, we cannot express enough our appreciation for your commitment to your fellow Vermonters. Thank you. The award committee and the Vermont Community Foundation are presenting this award and a plaque to the health department today. This is what the plaque says. The Con Hogan Award for Creative Entrepreneurial Community Leadership presented to the Vermont Department of Health for exemplary COVID-19 response. The award recognizes the Vermont Department of Health, Commissioner Mark Levine, MD, and all department staff for their commitment to the safety of Vermonters during the pandemic and for their rigorous and tireless work to deliver on that commitment, demonstrating the leadership qualities recognized by this award. Focusing on results, using data and measurement to mobilize action, working with people across diverse perspectives, taking risks in pursuit of the vision, and persisting through setbacks. Presented December 9th, 2020. Dr. Levine has the plaque, and I believe he can show it to you now. There it is. Congratulations, Dr. Levine and all the staff of the Vermont Health Department. Framed copies of this award have been provided to the health department so that 12 regional offices and the state lab will each have one. At this time, I would like to invite several members of the health department's leadership team to share their thoughts. We'll first hear from Deputy Commissioner Kelly Doherty, then Deputy Commissioner Tracy Dolan, and finally, Commissioner Dr. Mark Levine. And now, I'm pleased to introduce Deputy Commissioner Doherty.
Good afternoon. Thank you so much for being here, everyone. And I can't tell you how honored we are to be receiving the Con Hogan Award this year. When the committee first reached out to the health department to say that they wanted to recognize someone from the Department of Health for this year's award, we quickly as a leadership team realized that there was no way that we could recognize just a single individual for this year's award. There are so many people involved in this response to the COVID-19 pandemic, and they are all giving so much every day that there was no way to highlight just one. I am so proud to be part of this department that despite its challenges, the exhaustion, the stress, and sometimes tears that have come with the work of battling this pandemic, our staff have continued to step up day after day and show such dedication to the work of public health, to the pandemic response, and to the ongoing day-to-day work of the health department that so many in the public aren't even aware of and may take for granted. So I'm so honored to be here today to receive this award on behalf of the department that I am so proud to serve. Thank you to the committee and to all of Vermont for recognizing the work of the tremendous staff of the Vermont Department of Health. Thank you.
And now I would ask Deputy Commissioner Kelly Doherty to, or excuse me, to Tracy Dolan to speak. Tracy.
Hi, thank you so much. Again, honored to be here. I think Steve Dale mentioned earlier that I think he used the word blessed to talk about what we've been able to do here in Vermont and the resources that we have. And I would use that word to describe how I feel working for the health department. It's always been a great place to work. And in this past year, I am humbled and honored to work there. Some of the things that are happening behind the scenes are really unbelievable. We have people stepping up in ways that you couldn't have imagined. We have a state toxicologist who has been ably running a massive call center. We have administrative assistants who are suddenly catapulted through the health operations center into positions of managing subgroups of people. We have staff that were formerly mid-level staff, now communicating directly with governors' teams and quickly, contributing to policy on the fly. So we just have all of these staff who have stepped up, taking on responsibility, and the number of hours that people are working, it's actually, we've been encouraging people to try to take some time away, but the sense of duty is phenomenal. The feeling that, but if I don't show up, someone else will have to do this. There's a lot of work and this is essential. It's really extraordinary. It's always felt great to work there, but to really see that dedication and that commitment and that passion. We have epidemiologists who are on with staff at long-term care facilities at 5:30 and 6 in the morning because that's when those staff are available. It's been incredible. And as much as the work has been amazing, the pressure on our staff has also been pretty phenomenal. And we're doing everything we can to relieve that. But as you see numbers rise, as you see, in some cases, deaths rise, the impact that has on our staff on a personal level is profound. Staff who feel so much like they hold this in their hands and so much like that this is our job to contain it, that we regularly have to remind them that we are one important part of a broader system of organizations and people in Vermont who all need to work together to get us through this, to contain it, and to help ultimately prevent transmission. So it's just been humbling to work. And as much as the three of us, I know Dr. Levine will speak soon, and Deputy Commissioner Doherty and myself, as much as the three of us are here today, in some ways, we are the least of the efforts. We are the tip of an iceberg that is huge, that is passionate, and that is moving forward despite any challenges that are faced by the team. So again, thank you so much. I knew Con Hogan, greatly admired him. I liked his straightforward approach, and he was very data-driven, and I hope that he will be pleased wherever he is to know that our organization and our insistence, both with Dr. Levine and the organization as a whole, on making decisions based on data first and foremost, and public health science first and foremost, is part of what has brought us to the forefront and among one of the more successful states in the country during a difficult time. So thank you so much.
Thank you, Tracy. And now, Dr. Mark Levine.
Thank you, Paul. I was really both pleased and so incredibly proud when I first learned the news that the Health Department had been chosen to receive the 2020 Con Hogan Community Leadership Award from the Vermont Community Foundation. And when I saw the comments in the press release recognizing the department and its staff for their commitment to Vermonters' safety in this perilous time, for their steady data-driven leadership, for their tenacity in the face of chaos, and for the creativity and community leadership aspects noted in the formal title of the award, there was no question in my mind that what we all regard as special about the health department has been on display for far longer than any of us would have wished for the whole state to see. And I can say with full knowledge and confidence that every member of this department has given so much of their dedication and loyalty to our mission, which is to protect and promote the best health for all Vermonters, than any leader could have dared to ask for. I couldn't begin to do my job as health commissioner without the extraordinary effort given in this most challenging time by every member of the health department team. Now, while the pandemic has obviously put us under the microscope and in the spotlight, I do want to note that Con Hogan was one of the health department's biggest fans. So whether it would be due to a once-in-a-century pandemic or to the too numerous to list achievements this organization has had over its existence, I would like to think that Con is smiling down upon us now. There are the obvious areas that the pandemic has exposed, including expertise in combating epidemics of infectious diseases, emergency preparedness, and health surveillance, laboratory, and epidemiologic science. But he would have also recognized we have so much else to be proud of in the areas of health promotion and disease prevention, environmental health, substance misuse prevention and management, injury prevention, maternal and child health initiatives, healthy aging, and as you heard, working across all sectors of government and community partnerships to deal with all of the determinants of health and the contemporary issue of health equity. Finally, as a respected and visionary leader in public health himself, Con, near the end of his life, long before COVID-19, was able to express to me personally his admiration for our strategic planning, tireless efforts, and data-driven approach, and the incredible things we were able to do to improve Vermonters' health and lives and future trajectories. As Janette alluded to, he would be thrilled and excited and proud of every one of you, whether you be at the central office or in one of the districts. This award in his honor is a tribute to each of you, and I am so delighted that we can all share it together. And again, thank everyone for bestowing this award upon the Vermont Department of Health. Thank you.
Thank you so much, Dr. Levine, Kelly, and Tracy. Those were terrific comments, and we thank you and all of your staff for your incredible contributions to all of us. This is well-deserved recognition. Every Vermonter is in your debt. I want to thank Governor Scott for his approach to the pandemic. Today, we are recognizing the work of the Vermont Department of Health, but we are also very grateful to you for seeking and trusting their guidance as we all try to find our way through this. This is both a thanks to the department for its approach and its tremendous expertise, but also to the governor for accepting their strong support and guidance. I want to thank Con's family for your ongoing support of this award as a vehicle to call attention to efforts to serve the public good. And finally, I want to thank all of you who are watching this for taking the time to join yet another virtual event and to provide your support of this incredible group of people. We look forward to next year when we will expect to return to our more traditional process as we seek individual nominations for the 2021 Con Hogan Award. Thank you for joining us and have a safe and healthy holiday season.